Welcome to Payments Playbook, the show where we explore the strategies and systems that drive smarter payments, stronger cash flow, and more profitable business. Brought to you by Paylink, the business-to-business payment experts. Now let's dive into today's episode. For today's episode of Payments Playbook, we have Alex Koshykova with BKey. Welcome, Alex, and thanks for being here.
Hi, Paul. Thanks for having me.
Oh, absolutely. To start with, Alex, can you give a little information and history, background of BKey, your role, and
Sure, I'd love that. I'm a little 2 years,
wow,
but I started my career in tech probably like in 2011, and I was doing a lot of public relations and marketing, and then I switched to management. And then 8.5 years ago, I started with my co-founder. We started a company called BKey, which is basically a tech consultancy firm that builds all solutions for the wellness industry. So it's pure tech, it's software, and now AI solutions are listed. And yeah, at some point we thought that building products for other companies is not enough for us, and we just started building as well. So now I'm also running called Yod. It's a medical for telehealth.
oh, really? So you're primarily strictly in the healthcare industry, is that correct?
Correct. Yes.
And as far as, tell me more about your startup for that telehealth. What's that all about?
Sure. Again, a little of the background story. We right after the war in my country, we has a lot of experience in telehealth before solutions. So after like a couple of weeks after everything started, we pretty fast we launched a telehealth platform for Ukrainians called Doctors for UA. And what platform does is it's a marketplace where and patients can register and doctors can their time and consult Ukrainians free of charge, considering that a lot of just couldn't get offline medical help.
Sure.
And we were the platform is still up and running. We have like 10,000 plus patients on the platform so far, more than 2,000. And then we're feedback from doctors. So they're like, yeah, the software, we don't experience any issues or bugs, but it's still hard to patients. We still don't have enough data. Like people still have to explain how bad your cough is with your words. So because we have a hardware, a few brainstorming sessions that we're going to build that them so they can have time data about the patient. So yeah, basically here's the prototype, here's the and then depending on what you need, you just add attachment, which is a stethoscope right now. And doctor, for example, my doctor in Ukraine can diagnose my lungs from his office or her office.
Wow.
And besides stethoscope, we have otoscope, thermometer, pulse ox, and we're working on EKG as well. All in one device, basically as a at device a solution that trying to bring to the US right now as well.
Wow, that's very impressive actually.
Thank you.
Yeah, obviously the big buzz out there right now is AI. How are you implementing AI in your startup as well as your existing offerings?
Sure. Obviously, we didn't want to miss that of AI, and once everybody started using it, brought into that as well. So at BKey, we are currently working, I think, on 5 healthcare products involvement of AI. And so again, I don't think we should call ourselves experts. I think anyone should.
No,
It's still
I agree.
too early. But yeah, sounds where we do are really, really exciting. Like for example, for one hospital, we're working on building AI agent prepare ORs, operation rooms for the surgery. So basically what AI agent does is facilitates every team member who needs the OR basically without any manual, because what happened before, there is an administrator with the phone who has to call person like, hey, you should bring this mats for the surgery, you should bring this equipment, and it was all
Sure.
done manually. And you can imagine it's like maybe 2 hours in the hospital. Okay, it's manageable, but where like 10 plus, that's becomes a mess, and surgeries can be delayed, can be postponed, canceled, and you have to do manage that also. Our AI agent creates, let's call them, to do each person who needs to do something to prepare the OR, and then collects it automatically, and then that everything is ready, or opposite, if something's not ready, and flags that issue to administrator to kind of figure out what's happening. So that's one of the example. Another example, we do a lot of work in trial phase, especially on patient recruitment. So what happened before is the clinical trial goes to their team. They prepare all the data needed for this specific trial. Like, what are the best
Right.
sites for a clinical trial? What are the groups and all that? And they take, depending on the size of the trial, days, sometimes weeks to prepare basically a PDF with all the data needed for that. And then if something is missing for some reason, manager has to go back to them another day or two, whatever. What
Yeah.
we do basically, we created some sort of a chat, and instead of just having a static document, the manager can just type your question, type your prompt, like what are the best sites in or states where I can have this trial, and it provides you real time the list of all the sites depending on the historical data and the patient data. So yeah, there are so many things to improve in healthcare, obviously, and AI is already improving lots of them, which is
Yeah.
exciting.
Oh, absolutely. It's a revolution right now. And, doing this podcast, I'm talking with people, it's interesting the different applications that people are implementing AI and how much it's streamlining. But you still need some human involvement, in my opinion. But
100% agree. Everyone who's saying that, oh, in a few years it's gonna change and be instead of doctors, I don't think this is anywhere close to true. And all of the solutions we're building, including our startup, we're not planning to substitute the doctor. We're just trying to ease the role of the doctor and make his or her work more efficient, and I guess decrease the burnout, because we all know that this is a huge problem for doctors, not just in America, but all over the world.
right. Well, in Ukraine, what you're doing there, I mean, it's a valuable service. I mean, the people aren't able to get to a doctor, and it's talk about I mean, extremely valuable service. They can still get their care, but not have to travel or not. It's not available, basically.
Right. Not across the whole country, but especially eastern, southern Ukraine, closer
Right.
to the front line. Hospitals are working, medical staff left either west or even some left the country. So yeah, obviously we have a huge shortage of healthcare professionals, and that's why we are very happy as a company that all of the years that we've building like solutions for businesses, we can use this expertise to actually do some social work and give back to the community. So that's why we're very happy about this project, and we continue to support it and sponsor it as well. So yeah, great.
Excellent. So, talking with the healthcare that you're doing, do you work or integrate with the big players, Epic, Cerner? I mean, there's a lot of them out there. Do you do any work with them?
So first of all, it would depend obviously on the client and the project. Not all the solutions need Epic integration or any HR integration. So
Right.
it really depends. But we have done a few integrations before. Right now, to be honest, we recommend to use third-party solutions to do the integration, because that layer of supporting like each request that goes to HR, usually not the actual development, but maintenance of that usually
Right.
is such a mess. Every time each HR like rolls out a new update, you need to support that manually, and it takes a lot of work. So that's why, at least last, I think, couple of years, we do recommend our clients to use third party solutions that have that layer, that their core businesses to make sure everything is working, whatever update is out there, and we think that's easier and less time and money consuming for our clients.
Right. Well, it's less disruptive too, and with all the updates, you have to stay up and what understanding any updates, what's it all impact, and I mean that's a full-time job, really.
Right, right. Yeah, 100%. But I mean, you know this better since you work in the payment system. I don't see a big problem of integration and using third-party solutions, and sometimes you just can't avoid that. Like, if my client needs get some payments, obviously I'm not gonna build it from scratch. Whether there's so many
Right.
solutions out there that tested and already have their name on it. So I think whenever you have a chance, especially when we're talking about earlier stage startups, when you have chance to save your resources and time on something that it's already built, I don't see a reason why not to use it.
Absolutely. Why reinvent the wheel? You know,
Right.
do what you're good at. And I mean, I've run into a few times where people think, well, let's take over the payment acceptance experience, don't have a clue as to what's involved, and they mess things up and it impacts or affects their core business. And why? You know, that's my question. Why do that? You know what you're good at? Stay with it. Stay in your lane, maybe that's a better way to put it. Are you see?
100%. Yeah, but
Are
the
you
only
see?
comment I would add, sorry, the only comment I
Oh,
would
go
add,
ahead.
you do need to sign some sort of BA with the third party, especially in healthcare, because if there's any data transfer and third party solution has some sort of access to the data, you need to make sure that you sign something with them as well. Otherwise, all reliability is on you only.
Right. Well, and with HIPAA, yeah, it's very, and I'm glad the security and confidentiality remains in place, and it has to. No, I appreciate that. Right now, are you seeing any major trends within the healthcare space?
Sound too obvious, but obviously you already talked about AI and asked about AI. I do think everybody's looking in that direction, like what AI can do, improving any industry and healthcare specifically. So yes, I do think AI is trying to get in any basically step of healthcare delivery, which is great because I believe that for the past 20 years, all we did was digitizing healthcare, basically from paper medical record, we went to electronic one. From fax, we went to telehealth or other things. But basically, right now, AI can actually change the whole concept of delivery. And again, still having doctors in the loop for sure, not replacing them. But clinical decision support. I'm very excited about prevention as well because what happened last 5, 6 years, we had so many wearables appear that can collect patients' data, but without proper machine learning algorithms, no one could really analyze that much data they generate. And that's why, like, yeah, we have all these devices, rings, watches, and all the other things, but like, doctors are not gonna sit there and analyze that much data.
Right.
They need machine to do that. So I think AI can help people analyze their health better and flag any issues as early as possible. And we all know that prevention is all about finding some problems early, and then you can treat them easily and more efficiently.
Yeah, actually, you brought up a good point. So I've had those watch. I have some friends that have that. What do they call an Aura ring or something?
Hmm.
Anyway, where does that data go to? I mean, is there a central repository, or where is that stored? I never thought about it.
So the problem is that it's stored specifically for each device separately, and that's I guess the biggest problem in the whole data collection thing because my ring has its own data set, my watch has its own data set. Yes, Apple collects that from their Apple Watch, for example, but
Right.
in order to figure out some trends and make some predictions, you need all the data to be aggregated and analyzed all together, and we're not there yet. So yes, my ring can tell me that I had a bad sleep yesterday, which I probably know without a ring as well. But without like all the my sleep data, all my biomarkers that other devices collect, without analyzing that all together and seeing this holistic picture, I don't think is going to be that useful. But I think we're getting there, and in the next few years, I think solutions going to appear that are going to aggregate all the data from different devices, analyze it with AI, and then can give you some really useful predictions and warnings.
Yeah, no, yeah, I never thought about that, but yeah, I mean, I obviously someone's working on it, and there's a business opportunity there somewhere for somebody.
For sure.
Yep. No. Wow. Regarding the AI stuff, prompt engineering right now, it's a skill set people are learning. And as people get better, they type into AI, Chat GPT or whatever, the age, symptoms, etc., and it'll come out with possible diagnosis of what their condition is. Do you ever foresee that coming into play?
So yes and no. Well, first of all, I do see on the news they're like once a month somebody like, oh, I couldn't find out my real diagnosis for the past 10 years, and then I fed all my data to ChatGPT and it could figure out. It's a miracle. It's amazing. So there are cases like that, and I think they're still true, but that doesn't mean that you can trust AI right now to diagnose and figure out what's wrong with you. So
And I
again,
agree with you.
there are obviously circumstances in life when like you literally just don't have access to a doctor, as Ukraine as an example. And yes, somebody might think, or I'd rather instead of just guessing, I'd rather ask AI, and it might be helpful. But we need at least a few more years to figure out how to make a reliable data set because all of the solutions that do similar things, they're using the foundational models, either OpenAI and Grok, Meta model, or whatever, and they're not trained specifically on evidence-based medicine data, which is a problem. So all the hallucinations might happen. It for you for your health, it might be a huge problem. There are some potentially LLMs that might be medicine specific, which I still don't know if they're gonna work properly or not. We'll find out soon, I guess. But
Yep.
I think we need to be very cautious about this. And you can do that. It's basically like, Dr. Google. Everybody was using Dr. Google before. Yeah, what's wrong with me? I'll Google it. Now it's Dr. ChatGPT. So not much change in that way, but
Right.
you still need to get proper consultation from a healthcare
Yep.
professional.
So in your startup with the device, what's that journey looking like to get approval? I mean, that's pretty heavy lifting, isn't it?
It is. We are literally right now in front of this challenge, basically planning to go through FDA. And yeah, my goal before was to try to set up a few pilots without FDA approval here in the US, which kind of failed. We are working right now on a few organizations to set up a pilot. But yeah, most of the times the doors are shut because nobody wants to mess around with patient data without FDA approval. So yes, we are gonna go through this very soon. We're working on pre-submission right now, and see what happens. The good news is that for us, with having other devices similar in the market, the path should be pretty straightforward and shouldn't take that much. Hopefully, less than a year, which actually for medical devices pretty good. Usually it's like
Yes, that's very good, actually.
3 to 7 years on average for medical devices, especially class two. But yeah, with some of the changes in the administration, some layoffs at the FDA, I feel like it might be a little slower than it used to be. But yeah, I mean, me as a startup founder, I gotta do what I gotta do. So have to go
Right.
through this anyway. So hopefully, I know maybe we can record this in a year, and I'll already have my FDA clearance.
Well,
And
that would be
yeah,
very cool.
hope so.
Well, the nice thing, well, I don't know if it's a nice thing, but you have proof of concept already in Ukraine, right? So you have that. And, yeah, you just got to go through the hoops to get approval. And I know it's not an easy process and it can be expensive.
Yep, that's why we are raising our pre-seed round right now. If anyone who's watching is interested in medical device, happy to share a deck.
Oh, so you are going through a fundraising right now?
Yeah, we've been bootstrapping so far. All the R&D we covered ourselves, some business development as well. But yeah, I'd like to raise a small round, pre-seed round, to go through FDA with that money, and then hopefully we'll start sales soon.
And I mean, if someone's listening and they want to, take a look at it, where would they get the pitch deck?
Sure. Well, first of all, you can check out the website. It's yod.health, YODD.health. You can just check out the information about the startup. Obviously, happy to connect on LinkedIn. If you can find me, Alex Koshykova. I think I'm pretty active on LinkedIn, so it shouldn't be a problem to respond to anyone who's interested. So yeah, I think if you're interested, reach out to me in any way you prefer, and we'll find a way to connect.
And you also have a website, BKey.io, correct?
Correct. So that's the website for our tech consultancy firm. So basically, it describes all the work and some of the projects we did in the healthcare and wellness space. But yeah, if anyone needs any tech support, we do have, I would say, healthcare probably like 80% of our portfolio. So we do have like 20% projects from other industries where we have a few projects in insurtech. We even had a projects for actors, which was a little out of our expertise in terms of like general industry, but still was a fun stuff. So yeah, if anyone needs help, please reach out.
Well, and actually, my space, I do payment acceptance. Have you ever done anything with accounts receivables at all? Any work within that? Any AI type things?
I don't think we've done any type of BI in that space yet, but again, we're very open to learn new things and
Okay.
spend our expertise. Yeah.
Well, excellent. Alex, thank you very much for participating in the podcast. I wish you the best luck on your startup. And like you said, we can talk a year from now, and I think things are going to be dramatically different.
I love that, and yeah, I'm sure a lot of things gonna change in a year. So yeah, thanks for having me, Paul.
You bet.